Welcome to Module 6. The topics covered in this module are related to assessment and evaluation, occupational analysis, and service implementation knowledge domain, which encompasses 10.7% of the questions on the CRC exam. The information in this module is organized into 3 lessons. 1. Functional limitations and capacities, assessment techniques and interpretation. 2. Occupational and labor market information, job skills analysis and matching. And 3. Job modification and restructuring, ergonomics and assistive technology, and DSM-V. The CRC exam includes 2 major sections, rehabilitation and disability, and counseling. The learning objectives for the rehabilitation and disability section are explain the occupational implications of functional limitations for individuals with disabilities, complete a job analysis, evaluate ergonomic, job accommodation, and assistive technology needs, formulate recommendations for job modification and restructuring techniques, and conduct a labor market analysis. For the counseling section, by the completion of this module, you will be able to identify and engage with resources used for the assessment process, perform both informal and formal assessments, perform a transferable skills analysis, evaluate the results of assessments for the purposes of rehabilitation planning, and implement computer-based job matching systems. The learning objectives and topics were generated based on information provided on the CRCC website. Module 6.1, Functional Limitations and Capacities, Assessment Techniques, and Interpretation. Topics covered in this review include vocational implications of functional limitations associated with disabilities, functional capacities of individuals with disabilities, tests and evaluation techniques available for assessing client needs, and interpretation of assessment results for rehabilitation planning purposes. Vocational implications of functional limitations associated with disabilities. Functional limitations prevent individuals from performing tasks required in a certain job position or prevent them from performing tasks as effectively as an individual without disabilities. A disability is a functional limitation that prevents an individual from performing a certain task, whereas a handicap is a functional limitation caused by environmental obstacles, and an impairment is a functional limitation caused by a medical condition. An individual with a psychiatric disability may have to overcome occupational, social, and societal barriers to succeed in the workplace. Occupational barriers occur when a psychiatric disability inhibits an individual from performing the responsibilities required of a job position. Social barriers occur when a psychiatric disability inhibits an individual from interacting with coworkers in an appropriate and effective manner. Societal barriers occur when an individual has difficulty obtaining or retaining a job position due to employers viewing the individual's disability in a negative way. Additionally, individuals with physical disabilities may experience functional limitations that inhibit them from obtaining or retaining a job position. Many job positions require employees to lift a certain amount of weight. Individuals with physical disabilities may experience lifting restrictions due to their disability and may be deemed unqualified for many job positions. Individuals with severe visual impairments may be limited to a small number of job positions due to being deemed unable to perform necessary job functions. Other broad effects of disability that may limit vocational opportunities include mobility limitations, preventing an individual from easily moving from one place to another, either due to a physical or visual disability. Motility limitations, these inhibit an individual from controlling body movements. Communication limitations inhibit an individual from communicating or interpreting communication effectively. And cognitive dysfunctions, which can inhibit mental faculties in a variety of ways. Functional capacities of individuals with disabilities. Functional capacity is the ability to perform necessary job tasks and a measurement of what an individual is physically and cognitively capable of doing. As such, functional capacity is communicated in terms of the skills that an individual has and the activities they are able to perform. Functional capacity is assessed using a functional capacity evaluation. There are 2 main types of functional capacity evaluations. 1. A general-purpose functional capacity evaluation assesses the skills required by a wide variety of different occupations. General purpose evaluations are typically performed before identifying potential job occupations for an individual. 2. Job-specific functional capacity evaluation assesses the skills required of a particular job occupation. Job-specific evaluations are typically performed after a potential occupation has been identified. Functional capacity evaluations can be used to assess an individual's physical capacities, mental capacities, or both. Physical capacity evaluations are performed by a physician or healthcare professional and assess the amount of physical exertion an individual is capable of performing, while mental capacity evaluations are performed by a neurologist or neuropsychologist and assess mental functions such as memory, concentration, social interaction, and ability to adapt to change. Counselors must also consider an individual's behavior and level of skill while assessing functional capacity. Behavior includes the set of tasks an individual actually performs on the job, while level of skill is the respective difficulty an individual will need to overcome in order to perform job activities with appropriate training and accommodations. Additionally, counselors will need to assess the levels of exertion required of potential vocational occupations in order to appropriately determine if an individual's functional capacities are sufficient to succeed in an occupation. There are 5 levels of exertion counselors should be aware of. 1. Sedentary positions require an individual to move less than 6 pounds regularly and no more than 10 pounds on any job task. 2. Light positions require an individual to move less than 11 pounds regularly and no more than 20 pounds in any job task. 3. Medium positions require an individual to move less than 26 pounds regularly and no more than 50 pounds in any job task. 4. Heavy positions require an individual to move less than 50 pounds regularly and no more than 100 pounds in any job task. 5. Very heavy positions require an individual to move at least 50 pounds regularly and potentially more than 100 pounds in an occasional job task. Finally, counselors should be knowledgeable of the level of skill required for different job positions. An unskilled position requires less than a month of training to perform job tasks. A semi-skilled position requires more than a month but less than 2 years of necessary training. And a skilled position requires more than 2 years of training to appropriately perform job tasks. Tests and evaluations available for assessing client needs. Test and evaluation formats. There are several test and evaluation formats which can be used to assess client needs. Some of the most common test formats in vocational counseling and/or evaluation include spiral tests, cyclical tests, speed tests, power tests, objective tests, subjective tests, forced choice tests, and the Rorschach and thematic apperception test. In a spiral test, questions become progressively more difficult throughout the test, i.e., earlier questions are easier than later questions. A cyclical test is a test with multiple sections, and each section is structured as a spiral test, i.e., cyclical tests are composed of several spiral tests. A speed test is composed of relatively simple, easy questions and measures how quickly an individual can perform or work through material by imposing a time limit on the test taker. A power test is typically composed of more difficult questions and measures an individual's breadth of knowledge. There is usually no time limit imposed on a power test. Objective tests elicit either correct or incorrect answers from test takers and are scored based on factual knowledge. Subjective tests elicit responses that are scored based on a rubric and test scorer interpretation. Subjective test scoring relies more on opinion than factual answers. Forced choice tests provide all possible answers as equally desirable selections, and all answers are acceptable as the correct answer. Personality inventories are an example of forced choice tests wherein no answers are wrong, but answer choices still provide insight on the test taker. The Rorschach and thematic apperception test, or TAT, are free response tests wherein ambiguous shapes or images are presented and the test taker is requested to talk freely about the shape or constructed narrative for the image. Rorschach and TAT are subjective tests that require a trained psychologist to correctly administer and interpret results. Terms related to popular testing formats. Difficulty index is a measure of the number of people who answer the test item correctly. Dichotomy, two possible answers that are directly opposite of each other. Multi-point item, test items that offer 3 or more forced choice answers. Normative test, a test in which the results are found by comparing an individual's response to a large population of test taker answers. Test and evaluation domains. Rehabilitation counselors utilize tests that measure various domains of innate characteristics, preferences, strengths, abilities, and more. The 4 most common domains utilized by rehabilitation counselors are tests measuring intelligence, aptitude, achievement, and personality, although other areas are often evaluated, such as vocational interests and work samples. Intelligence tests are designed to measure an individual's intellect and objective reasoning. Common intelligence tests are Wechsler's intelligence tests, and these include Wechsler Preschool and Primary Scale of Intelligence, WPPSI, designed for children ages 3 to 7, Wechsler Adult Intelligence Scale, the WAIS-4, designed for individuals ages 16 and older, the Wechsler Intelligence Scale for Children, the WISC-5, revised test designed for children aged 6 to 16 years and 11 months, the Stanford Binet Intelligence Scales, 5th edition, SB5 or SBV5, Peabody Picture Vocabulary Test, 4th edition, PPVT4, Slauson Intelligence Test Revised, 3rd edition, SITR3, the Beta-4, and Raven's Progressive Matrices. Aptitude tests are designed to measure an individual's ability to perform a specific task or to assess an individual's skill in a particular area. Common aptitude tests are the O-Net Ability Profiler, AP, Armed Service Vocational Aptitude Battery, the ASVAB or ASVAB, and Differential Aptitude Tests, 5th edition, Form C and D, the DAT-5. Achievement tests are designed to measure how an individual's existing level of knowledge. Common achievement tests are the Wide Range Achievement Test, 5th edition, WRAT-5 or RAT-5, the Peabody Individual Achievement Tests, revised, PIATR, the Adult Basic Learning Examination, 2nd edition, the ABLE-2. Personality tests are designed to measure innate personality characteristics. Common personality tests are the Minnesota Multiphasic Personality Inventory, 2nd edition, MMPI-2, the Myers-Briggs Type Indicator, the MBTI, the 16 Personality Factor Questionnaire, Form E, the 16PF, the California Psychological Inventory, or the CPI, and the NEO Personality Inventory, or the NEO-PI. Vocational interest inventories are designed to help identify which jobs individuals are most likely to derive satisfaction from. Common vocational interest inventories include the Strong Interest Inventory, the Self-Directed Search, or SDS, Reading Free Vocational Interest Inventory, 2nd edition. Psychometric tests are designed to measure human developmental stages. Common psychometric tests are the Minnesota Occupational Rating Scales and the Guilford-Zimmerman Temperament Survey. Psychopathology assessments are designed to identify and diagnose mental disorders as outlined in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. Common methods used in psychopathology diagnosis include the structured clinical interview for DSM-V, the Million Clinical Multi-Axial Inventory, 4, the Symptom Checklist 90 revised. Work samples are designed to assess if an individual follows procedures appropriately and can be used to further evaluate vocational aptitudes, temperament, vocational interests, dexterity, work habits and behaviors, learning styles, comprehension, and more. Common systems used to administer and evaluate work samples are McCarran-Dial Evaluation System, MDES, VALPAR, the Microcomputer Evaluation of Careers and Academics, MECA, and the Vocational Interest, Temperament, and Aptitude System, or VITAS, VITAS. Situational and ecological assessments are designed to assess an individual's current performance on a specific job task or location. Common situational and ecological assessments are supported and customized employment assessment and on-the-job evaluations. Interpretation of assessment results for rehabilitation planning purposes. A counselor must perform several steps both before and after an assessment in order to appropriately interpret an individual's assessment performance and apply the results to vocational planning. Before assessment. Before an individual participates in an assessment or evaluation, the counselor should explain the purpose of the assessment in order to ensure the individual understands what is being tested and why. Counselors should ask the individual to express any questions or confusion they have about the assessments that will be performed in order to ensure the individual is fully informed on the assessment and identify any misunderstandings which may affect the individual's performance. Finally, the counselor should take steps to reduce the effect of any language or cultural differences will have on the individual's performance in the assessment. Performing these steps before an assessment will ensure accurate and reliable results that can be used for rehabilitation planning purposes. After assessment. After an individual has completed their assessment or evaluation, the counselor should examine results and determine trends that indicate a particular set of skills. Counselors should then organize results into a convenient format that provides clear interpretation. Finally, counselors should assess the reliability and validity of assessment results and focus on the individual's positive attributes while communicating assessment results. Module 6.2 Occupational and Labor Market Information, Job Skills Analysis, and Matching. Topics covered in this review are occupational and labor market information, methods and techniques used to conduct labor market surveys, job analysis, transferable skills analysis, and computer-based job matching systems. Occupational and labor market information. The U.S. labor market is comprised of two major categories, primary sector jobs and secondary sector jobs. Primary sector jobs, i.e. white-collar jobs, require more expertise and education than secondary jobs. These jobs typically offer better benefits, higher pay, and a greater chance of advancement within the company. Secondary sector jobs, i.e. blue-collar jobs, typically require less expertise and education to perform job tasks. Secondary sector jobs often offer very few benefits, less pay, and few to no opportunities to advance within the company. The U.S. labor market foresees an increase in the number of service jobs available, a decrease in the number of manufacturing jobs available, and an increased need for formal education. Counselors and individuals primarily locate information about occupations from three main organizations: federal, state, and private agencies. 1. Federal agencies include any government agency that provides employment data or occupational information related to overarching employment throughout the U.S. Additionally, federal agencies provide information related to national employment regulations and enforcement. Examples of federal agencies include the Bureau of Labor Statistics, the American Disability Association, and the Equal Opportunity Employment Commission. 2. State agencies include any government agency that provides employment data or occupational information related to employment within a particular state. Additionally, state agencies provide information related to employment regulations or enforcement as it pertains to a particular state. 3. Private agencies are not directly related to federal or state governmental occupation information or regulations. Private agencies provide specific employment data, occupational information, or information related to changing regulations. Examples of private agencies include employers, labor market research firms, and professional associations. In addition to the three main agencies listed previously, counselors and individuals can utilize various publications, programs, and websites to identify occupational information. The Occupational Information Network, or ONET, is an online database that contains a wide variety of occupational information related to the skills a various person must have for a particular occupation, the requirements of employment in an occupation, the duties and responsibilities of various occupations, and the anticipated trends within occupational fields. The ONET was created to replace the Dictionary of Occupational Titles. The Dictionary of Occupational Titles, or DOT, is an encyclopedia-style reference book that contains information akin to the ONET but is supplied in physical, i.e. book format, rather than an online database format. The DOT classifies occupational categories using a 9-digit code. The first 2 digits signify the occupational code, e.g. 83. Occupational groups are signified by combining the third digit with the first 2, e.g. 831. The fourth digit signifies employee functions in relationship to data, e.g. 8314. The fifth digit signifies employee functions in relationship to people, e.g. 83147. The sixth digit signifies employee functions in relationship to things, e.g. 831475. The seventh, eighth, and ninth digits aid in discriminating differences between closely related jobs. The Standard Occupational Classification System, or SOC, is primarily used by federal statistical agencies to classify workers into occupational categories and collect, calculate, and distribute information related to specific occupations. Workers are categorized based on if they work broad or detailed occupations and if their work belongs to a major or minor employment group. Job positions are classified and provided with a 6-digit code used to organize the SOC. The North American Industry Classification System, or NAICS, is used by federal agencies to classify businesses and collect, analyze, and publish data related to the U.S. business economy. Businesses are assessed and assigned a 5-digit code. The first 2 digits identifies the major economic sector the business occurs in. The third digit identifies the economic subsector the business operates in. The fourth digit identifies the industry group, and the fifth digit identifies the specific industry the business operates in. The Occupational Outlook Handbook, or OOH, provides information on over 250 occupations organized into 19 broad categories. The OOH provides information related to the nature of the work required in specific positions, typical work functions and tasks, general working conditions of occupations, education, training, and other qualifications needed for job positions and employment prospects for different job positions. The OOH is a beneficial resource to vocational counselors and can be used to help inform individuals on the qualifications needed to succeed in various positions. Vocational counselors need to be able to locate information on various occupations in order to perform the job matching process and match individuals to occupations they are best suited for. To conduct job matching with individuals participating in vocational rehabilitation, counselors should first interview, test, and conduct assessments to determine an individual's strengths, skills, and limitations. Next, counselors should use career resources identified previously to identify specific occupations the individual may be well suited for and use their identified strengths. Finally, the counselor should utilize the career resources listed above or various publications, programs, and websites to locate and contact specific employers who are hiring for positions that suit the individual. The job matching process can be conducted with a skill-based job matching strategy or a function job matching strategy. Counselors who use skill-based job matching strategies aim to locate jobs that focus on utilizing the strengths and skills the individual currently possesses, while functional job matching strategies focus on locating jobs that account for the individual's functional limitations and do not require task performance beyond what the individual is capable of performing. Essentially, skill-based job matching focuses on identifying an occupation that can maximize the use of the individual's existing skills, while functional job matching strategies focus on identifying an occupation that does not surpass the individual's functional abilities. Methods and techniques used to conduct labor market surveys. A labor market survey is a method of gathering information about a local labor market in order to evaluate if an individual is qualified for a position, assess the likelihood of the individual being placed in that position, and estimate starting salary expectations. Labor market surveys also inform on how many different types of jobs are available in the local economy. There are 4 main factors that should be identified in any labor market survey. 1, the size of the current labor force, i.e. the estimated number of people currently employed in a particular area. 2, the unemployment rate, i.e. the estimated percentage of people who are eligible to work in a particular area but aren't actually working. 3, the total labor force available to employees, i.e., the estimated number of people an employer could choose to hire if looking for employees. And 4, the occupation mix, i.e., the set of occupations that are currently located in the area and how those occupations are expected to change over time. Conducting a labor market survey. There are 3 main types of sources a counselor may use when conducting a labor market survey, though there is no limit to the range of sources available. While counselors can find labor market survey information using a variety of methods, the 3 most common sources are employers, internet sources, and occupational publications. Counselors strive to answer several questions during a labor market survey. Some of the most important questions to answer are: what is the relative competitiveness of the market, determined by assessing the number of available jobs in the area? How the market is changing, determined by looking at market trends or career resources? And what are the available occupations in the area and the skills required for each occupation, determined by gathering information about the industries in the area, current job openings, and utilizing career resources. There are 4 basic steps a counselor should perform while conducting a labor market survey. Counselors should identify the specific industries or occupations in which the individual may be able to utilize their strengths and skills. After identifying relevant industries or occupations, the counselor should identify specific local employers who are hiring. The counselor should contact several potential employers and visit employers' websites in order to collect data on available positions, qualifications needed to fill the position, and the wages and benefits associated with the position. After gathering information from employers, counselors should check all information gathered against other resources such as job openings and labor turnover survey, and compile their information into a report to be shared with the individual receiving services. Job analysis, transferable skills analysis, and computer-based job matching systems. Job analysis is a review of an employment position in terms of the skills, traits, and tasks one must perform in order to accomplish the job responsibilities. Job analyses are especially important to rehabilitation counselors as they are the primary method of determining if an individual has the skills required to perform the job duties. Job analysis requires a job to be broken down into tasks and subtasks to determine how the job is performed, where tasks are performed, why tasks are performed, and what is accomplished. Job analysis also accounts for the tools, equipment, machines, work aids, and materials used while performing the job. Finally, job analysis analyzes the physical requirements, working conditions, and vocational preparation needed to successfully perform job tasks. A comprehensive job analysis involves analyzing the purpose, DOT data, hiring requirements, salary, tasks and elements, vocational aptitudes, temperaments, physical demands, interests, working conditions, general educational development, specific vocational preparation, tools and machines used, interpersonal interactions, unscheduled work demands, and architectural barriers involved with the specific job posting. A transferable skill is an ability, skill, or area of knowledge an individual possesses which may be useful in a potential future occupation. Counselors use a transferable skills analysis to identify the abilities, skills, and knowledge an individual currently possesses and may be able to use in another occupation, as well as identifying occupations that a person may be able to perform. Transferable skills analyses are typically performed using the following steps. 1. Identify the individual's strengths and skills through various assessments and evaluations. 2. Examine each skill and compare it to skills used in other occupations to determine if the skill is transferable or job specific. 3. After identifying transferable skills, reference the DOT, ONET, or other career reference materials to identify types of occupations appropriate for an individual with those transferable skills. And 4, use a job matching system to find specific occupations that the individual can perform, as well as specific openings within each occupation. Computer-based job matching systems. A computer-assisted career guidance system, CACG, is a computer program that allows individuals to identify their transferable skills and suggest how they could be put to use in different occupations. CACG systems are hosted in counselors' offices and allow individuals to take a series of assessments and provides regularly updated occupational information based on assessment results. An internet-based interactive career planning system, ICP, is similar to the CACG, except it can be accessed from any location, not just a counselor's office. A job matching system is another computer program that searches through a series of databases to match an individual's skills with available vacant occupations. Advantages of computer-based job matching. This allows individuals to access to potential occupations quickly and easily, as the counselor does not have to manually search for alignments between transferable skills and available occupations that match the individual's skill set. Computer-based job matching performs a transferable skills analysis quickly and easily as part of its main operational function. Individuals can engage with their assessments and evaluations independently, lessening the burden on counselors. And computer-based job matching provides a greater variety of potential occupations with little to no effort on behalf of the counselor. Disadvantages of computer-based job matching systems cannot consider all factors relevant to an individual's functional limitations and transferable skills. There may be personal factors a counselor would take into consideration when locating potential occupations that a computer system is not programmed to integrate into occupational selections. Computer-based job matching systems do not have access to all the materials and resources available to a counselor. The computer-based system can only access occupations which have been entered into a database and has no functional knowledge or ability to access occupations which are available but not entered into an occupational database. Computer-based job matching systems can occasionally be too thorough and identify jobs that may loosely relate to the individual's skill set but are not a good overall fit. Module 6.3, Job Modification and Restructuring, Ergonomics and Assistive Technology in the DSM-V. Topics covered in this review are job modification, accommodations and restructuring, ergonomics and assistive technology, and features and navigations of Diagnostic and Statistical Manual of Mental Disorders 5. Job modification, accommodations, and restructuring. Job modification occurs when an employer gives an individual permission to perform a particular job in a different or alternative way, thus accommodating the job task for the individual's unique functional limitations. Accommodation occurs when a workspace is customized to an individual's needs. There are three main types of accommodation. Physical accommodation involves changing the layout or setup of an individual's workspace. Resource accommodation involves hiring someone to assist an employee with a disability in completing or gaining access to their job tasks. And equipment accommodation involves providing specialized tools, workstations, or other equipment to help an employee complete their job tasks. Job restructuring involves changing the responsibilities of a position in order to meet the needs of a specific person. Job restructuring commonly occurs in two methods: job carving. In job carving, some of the tasks and responsibilities assigned in one position are reassigned to a different job position. Job carving helps to restructure an existing job position so that an individual with disabilities can complete all the tasks and responsibilities of the job position by removing tasks they are unable to complete. In job creation, the employer develops a new position to fulfill needs that were not previously being filled by any specific job position. Job carving helps to restructure an existing organization by creating a position that fulfills needs that were not previously being fulfilled. Ergonomics and assistive technology. Ergonomics is the study of how design affects the ability to perform duties and responsibilities related to employment positions. Ergonomics is related to the study of work design modifications. Human factors engineering is the process of designing equipment, customizing tasks, and modifying the environment to meet the needs of an individual with disabilities employed in a specific position. Human factors engineers in related to the application of information acquired in ergonomics. Assistive technology is any device, service, or technique that allows an individual to perform daily tasks. Two common groups of assistive technology are augmentative and alternative communication devices and durable medical equipment devices. Augmentative and alternative communication, or AAC, are devices and techniques an individual can use to improve functional communication. And durable medical equipment, or DME, are devices and techniques that allow an individual to overcome a physical limitation and restore function. Orthotics relates to the creation and effective use of devices that help a person move and support their body. There are four main types of orthotic devices. Lower extremity devices help move, support, or restore functioning to the ankle, foot, knee, hip, or lower back area. Spinal devices help support the head or back. Upper extremity devices help move, support, or restore functioning to the arms, elbows, fingers, hands, shoulders, or upper back area. And simple or special assistive devices are devices that help move and support the body in a range of areas but are not fitted to the body, like an ergonomic computer mouse. Features and navigation of the DSM-V. The Diagnostic and Statistical Manual for Mental Disorders, 5th edition, the DSM-V, is used to guide the diagnosis of psychiatric and mental health disorders. The DSM-V contains specific criteria that must be met to diagnose disorders, as well as billing codes for each disorder. The DSM-V provides an opportunity for rehabilitation counselors to learn more about specific disorders, gain a better understanding of an individual's diagnosis, and assimilate knowledge into proposed rehabilitation plans. The DSM-V contains sections that provide information on each disorder and can help counselors navigate the material provided. These sections are diagnostic criteria, specifiers, diagnostic features, associated features, prevalence information for the U.S., development and course, risk and prognosis factors, culture-related diagnostic issues, diagnostic markers, suicide risk, functional consequences, differential diagnosis, and comorbidity.